After the procedure, let's say upper and lower teeth supported by dental implants, what could they expect? Like, what's the recovery like?
The recovery is minimal. You know, that they're going to be, I usually say don't go out and party that night.
Okay.
The next day, they're going to be a little sore. They might have a little oozing of some bleeding, but their post-operative pain is minimal.
Okay.
I've had patients playing golf the next day,
Okay.
and I don't recommend that at all.
Okay.
But it's very minimal.
What about medications?
Medications, we do prescribe medications as a backup, but most of the time it's controlled by over-the-counter Tylenol, ibuprofen, you know, your basic over-the-counter medication.
Okay. And what about, like, do they rinse their mouth quite a bit? And if so, what do they rinse it with?
Well, we give them a prescription rinse that they'll use to rinse for the first week. That just helps keep the bacteria down in their mouth to let things heal, speed up the healing.
So what about brushing?
Yes, they can brush
water
their teeth.
picking.
Correct, yeah. The first week we'll have them brushing just to keep the bacteria off their teeth. Water picking will usually start about week 2. We don't want to water picking too soon, so it's really just light brushing and rinsing for the first week.
And what about food? Like, what can they eat? Like, what kind of things can they eat that first week?
Great question. They can eat. Day 1, they can start eating. It will be a softer diet initially, so we're not having them eating jawbreakers and rock candy and chewing ice and all that stuff the first couple weeks.
But they can eat like a sandwich or bread?
Correct, yeah. As softer breads. Again, things that are really, really hard. You know, I tell them it's kind of like a post setting up in concrete. We don't want to be wiggling the post too much while the concrete's setting up, and the same with implants. So everyday chewing, sandwiches, like you said, are perfectly fine. Ground beef, that kind of stuff is perfectly fine.
And they, now, what about like biting their cheek? I mean, it's a new teeth.
Yeah.
Do they have to just kind of get used to that
There's
slowly?
there's a learning curve with it for sure. A lot of these patients, you know, have had dentures, and so the way that they talk has been impeded because of the big hunk of plastic that's in their mouth. And now all of a sudden they don't have that anymore. So we usually see there's a small learning curve with them being able to talk like they used to, tasting food and everything like that. So there is a small learning curve. Usually I would say within a week or 2, they've nailed it.
And how many weeks after the procedure can they start eating steaks and, you know?
Yeah, great question. Well, we'll usually say 5 to 6 weeks after the procedure.
And then they can pretty much eat whatever they want.
Then they're back to eating.
Are they ever afraid? Do they ever say, Doc, are you sure?
Every once in a while.
They could bite into an apple with their front teeth?
Yeah. Every once in a while we'll have those that are just so worried about it because, number one, they haven't been able to do it for years. And so, you know, now we're like, go, do it. We want you to do it. We want you to experience that. And they're a little hesitant, but they do.
And then when's their first follow-up? So they've had the procedure done. When is the first follow-up where they come see you again, if everything's going well?
I'll usually see them within a day or 2 after the procedure, just to making sure they're chewing good, making sure their teeth are coming together, making sure they like their smile. So I see them right away.
And then after that?
After that, I'll usually see them in a couple weeks, and then after that, it's for their first cleaning.
Which is?
About 3 months. Well, we usually see them in 3 months. That 3-month mark, we want to see how are they taking care of them at home, because that's important. And so we're just going to monitor them and say, all right, how are we doing with the cleaning at home? Do we need to tweak things? Do we need you to help you with anything on your end to make sure that you're maintaining
Now,
them?
if they follow the cleaning protocol, meaning seeing the dentist a couple times a year or once a year, could these last as long as they last, like regular teeth?
Yeah, I mean, the first implants were done, you know, what, 50 years ago, somewhere there, and there's a lot of those are still in. So we know the track record of these is fantastic. And really, it's on how they're maintaining them. If they can maintain them, the success is super high.